Hello classmates, this is Tia Townsend. I am here with week 2 discussion video form for our Nursing 450 class. The model I chose today to talk about was the Joanna Briggs Institute model. It's also known as the JBI model. It sees evidence-based healthcare as a process that goes through cycles where healthcare research is looked at, appraised, or made and then translated so it can be applied to healthcare practices. This model also looks at the effectiveness of new practices as well as how appropriate and feasible they are for a specific population in a specific setting. This model also emphasizes the need for feedback from healthcare professionals and users or patients who are using stated evidence-based practices. This model can be summed up as prioritizing content-aware evidence-based practices to improve healthcare outcomes with continuous evaluation of said practices. The JBI model does have different stages. The different stages are the first one being knowledge discovery. This is where you identify the needs and generate research evidence. The second is evidence synthesis. This is where you review and appraise the research findings. Then we move on to translation into practice recommendations. This is where we develop guidelines and tools based on said evidence. The next stage is integrating into practice. This is where we implement those evidence-based practices into healthcare settings. And then the last stage is evaluation. This is where we're assessing the impact of implemented practices on healthcare outcomes and seeing what those healthcare outcomes are. Some other key points about the JBI model are this model takes a holistic evidence into consideration and goes beyond just the effectiveness. It incorporates factors such as feasibility, appropriateness, and meaningfulness when assessing healthcare interventions. The JBI model also focuses on context and the recognition that practices need to be tailored to specific populations and healthcare settings. This model also focuses on growing nursing knowledge by emphasizing actively evaluating the practices for effectiveness and best practice models. This model also emphasizes the need for a user/patient-centered approach, and it also prioritizes the need of the healthcare professionals in identifying research questions and applying evidence. This model is the best, and it evaluates this model is really good at evaluating the best practice models because it's always evaluating and continuing to monitor the effectiveness of practices that have been implemented. This model could really be brought into my own practice very easily since we do kind of rely on best practice, best evidence in the school nurse setting. This model can definitely help me continue to evaluate the methods that I use and make sure that they are best known and best effective. Thank you for your time, and I hope you have a great week.